Good day, everyone. Uh, I will use this opportunity to welcome us all into today's class session. And I am Mr. Uyudino Joshua by name, and I will be our resource person who will be taking us through this course NSC 204 titled International Health. So, um, I would just want us to have a broader view, or let me just say an overview of what this class session is all about. So this class session is divided into 13 weeks of teaching, and which will be done via online module teaching like this. So I would just want to encourage us to regularly check our module provider, our portal, to be updated and get information. So I would like to inform us that today's class session is just going to be an introductory class. So I would just want you to pay attention and stay with me. And if you have any question, please feel free to drop it at the comment section. All questions will be addressed at the end of the class. So without any further ado, let's dive into today's class session. And before we proceed, let me just take us through the course overview, and which is to provide students with a solid foundation in international public health principles and to build competency in using the tools and methods necessary to improve the health of disadvantaged populations in an efficient, sustainable, and equitable way. So let me quickly take us through the course content, and which are meaning and concept of international health, historical perspectives of international health, determinants of health and major health problems of populations, policies governing international collaboration and coordination on global health issues, agencies involved in international health and their activities, types of global health and various global health policies. So at the end of this class, and these are what we're expected to be able to say, oh, I've learned something. So within the context of the course content, we should be able to define and describe basic concept of international health, identify the key elements, structure, and essential services of health systems, identify the responsibilities of various stakeholders in international health, describe major endemic, infectious, and non-communicable diseases, and understand how to appraise their impact on the health of populations, initiate sustainable improvement in health systems, identify and analyze interrelated determinants of health and major health problems of a population, describe the activities of multilateral and bilateral agencies, analyze the policies governing international coordination of global health, write appropriate research, so and also communicate and work and make the professional and multidisciplinary team. So let me just take us through the meaning and concept of international health. So, the international health refers to the what? To the study and practice of health issues that transcend national boundaries, focusing on improving health equity and health equity among nations. So these are the key concepts we will be focusing on, which are the global health systems and infrastructure, international cooperation in public health, health inequities between high income and low income countries. So let's look at the historical perspective of international health, and these are the key historical milestones. So from during the 1850s, these are when the campaigns for sanitation and disease prevention took place, and this is a very early public health campaigns. So, and during the post-World War II, which was when the establishment of global health organization like WHO took place also. So, and during the 21st century, we also have the rise of global health security, pandemic preparedness, and sustainable development goals. So, let me just quickly also take us through the health system and essential services. So, in an health system, so we have essential services that are being offered. So, when a patient is being taken to an hospital, the first point of contact and basic care is what we call the primary care. So from the primary care, we have what we call the secondary care. and this is when specialists are being when the patient are being referred to a specialist. So we also have what we call the tertiary care, and this is when it's required an advanced medical treatment. So within an health system component, should I say what the system that are made up of health is what we have like such as we have infrastructure, workforce, technology, and governance. So let me just also quickly take us to the interrelated determinant of international health. So what determined the health status of a populations internationally? So we have what we call the social determinants, which include the poverty, education, employment, and social support. We also have what we call the environmental determinants, which include the access to clean water, sanitation, and air quality. So we also have the behavioral determinants, which include lifestyle choices such as diet, exercise, and smoking. We have what we also call the genetic determinants, which include hereditary factors affecting health. So we have political and economic factors, which include the governance, access to healthcare, health finance, and income inequality. So, and lastly, we have the cultural factors, which include what the traditional practices and community involvement. All these are going to be discussed in detailed in next class or during the week session of this uh, course, this topic when we are going to be having this topic. So this just don't forget this just to be an overview of what you expect at the end of all the class sessions. So let's look at the major health problems of populations. So we have the major infectious diseases. I also have the non-communicable diseases, right? So those diseases that can be infected or that can be transferred from one person to another. For example, we have the malaria, which is a vector-borne disease which are prevalent in tropical regions. So we also have tuberculosis. This can be this is even very infectious. So we also have HIV and HIV/AIDS, which is a viral infection affecting millions of people worldwide. So example of non-communicable diseases, you have heart diseases. Um, this kind of disease cannot be infected or cannot be communicated to another person. It is non-communicable. So we have the diabetes too. We also have cancer. So all these are going to be looked at a very comprehensive and holistic way. So let me quickly take us through the policies governing international health collaboration, where we'll be looking at the World Health Organization, that is the standard and the the technical support they provide, and mostly they lead the global health responses. Right, whenever there is an issue globally, they usually lead these global health responses to any problems worldwide. So we also have Global Fund to fight AIDS, tuberculosis, and malaria, and we have Sustainable Development Goals too, which will be uh, analyzed and deciphered when we have this topic during the week. We are be having the topic. So let me also quickly take us to the agencies in international health and their roles. So we have multilateral agencies and we have bilateral agencies. For example, we have uh, World Health Organization, which is a multilateral agency. That is, it coordinates international health efforts. Which we also have United Nations International Children's Emergency Fund, which is also known as UNICEF, and which this focus on child health and maternal care. So example of bilateral agencies include the United States Agency for International Development, such as USAID. And what this agency does is that it promotes global health and development through foreign and health programs. So, and other example of bilateral agency is the Department for International and Development, which is also known as DFID, which focus on poverty reduction and development of in low income countries. So let me just quickly take us through the global health types and policies. We have policies like uh, the Universal Health Coverage, which is UHC. We also have Global Health Security Agenda, which is known as GHSA. So UHC Health, UHC, which is health access for all without financial hardship. So while the GHSA, which involve the prevention and response to infectious disease threats. So let's look at the types of global health. We have the preventive global health, which focuses on disease prevention through vaccines, sanitation, and education. We also have the curative global health, which involves medical treatment and interventions for existing diseases. We also have humanitarian health assistance. We also have the developmental health. So all this will be taught holistically during uh, class or during the week assigned for it. So let me quickly take us through the sustainable health system improvement too. So we have strategies for health system improvement, which include strengthening healthcare infrastructure, capacity building for health workers, through financing and policy reform. So I also want to take us through the research proposal development. So when writing a proposal, um, these are the things or these are the steps how it is advisable or a standard way of writing a proposal. So you have to identify your research topic. At least you have to choose the relevant global health issues. So also formulate research question, define a clear and specific question. Also outline your achievable research goals, that is your objectives. Also let us know your study design, target population, data collection and analysis, which is your methodology. So and also you have to analyze existing studies to identify what the gaps, and which is going to be your literature review. Also just ensure informed consent and confidentiality, which is the ethical considerations, and also the budget and timeline and expected impact. So let me also quickly walk us through the professional communication and teamwork, which include the multidisciplinary collaboration, and this actually include combining expertise from medicine, nursing, public health, and policy to address global health challenges holistically. So, why or in a system where you have to work with different kind of people from other medical line, like for example you are a nurse and you have to work with a doctor or a quack. So you have to be able to communicate yourself and able to work in a team. So the roles majorly are going to be discussed in our next class. So just I want you to just brace yourself, and materials, the resource material for this class session is going to be shared, and I want us to go through the resources, and I would like us to we watch these videos too. So if you have any question, please do well to drop it in the comment section as I said earlier. And if there is no question, I want you to just go through all this again, and I'll be expecting you to come and fire me with different questions. So in conclusion, international health is a motivated field that addresses health disparities across borders. So it involves understanding health system, key stakeholders, and diseases affecting populations, and through sustainable approaches and global coordination. So last thing, uh, in the global health can be achieved. So thank you for staying with me to the end of the class. See you next class.